Okay, so welcome everyone. Thanks for joining us tonight. I'm Julianne from the Deschamps Foundation. And yeah, we're very excited that Chelsea's here tonight to talk about back and forth. And I'll just turn it over to her. So if you are online, if you have any questions, just type them into the chat. As we do. Yes. Welcome everyone. Like Julianne mentioned, my name is Chelsea. I'm a strength coach and an exercise physiologist. And I work out of the Bill Warren Training Center up at the Nordic Center. This is pretty casual here today. So if you guys have any questions, please pop your hand up or offline. So what we're going to go through today is a little bit about anatomy when we're talking about that. We're going to talk about some usual injuries that happen because, well, back injuries are very individual. They're also usually kind of standard. You know, most people do the like, I pull my back, or I put my back out doing something. So we'll talk a bit about the usual injuries, the patterns that they occur in, movement patterns in your back and your spine, and then we're going to talk about how to train, ideally, to avoid any back growthy. And then we're going to talk about the back legs when it's really necessary for sure to go see a professional doctor or physiotherapist. And then we're going to get to do some practical stuff to talk about what to do now that we've learned everything about backs. So when we talk about anatomy, there are many different pieces happening in the torso. How about anatomical knowledge on like we use the bucket scale from good to bad? Where are we at? Medium. Okay. So there's lots of different muscles and layers of muscles, bones, and tissues and stuff happening in the torso. This is obviously the front of the human being. And you can see there's muscles under your ribs, there's muscles over your ribs, there's layers of your pec muscles, there's lots going on, and it all impacts how your spine is moving. And then when we look at the back, we kind of have the same thing going on. Same idea. So all the way down along your spine, there's muscles that are attaching the whole way. Stuff that's moving you forward, backward, left, right, rotationally, lots of stuff going on. And if your brain doesn't have excellent control over all these muscles, you can imagine how things start to get out of whack very quickly. And the hip is a good example of something. We'll talk more about this in depth, but the hip is a really big impactor on the low back. You guys have probably heard the thing where if you have tight hip flexors and then you automatically have the grumpy low back kind of thing. It's not quite to the same extent, but you can see that your hip flexor muscles do attach all the way along your low back, and so they can certainly have impact depending on how you're moving and what you're using to move yourself and your skeleton. So on the far left there, you can see segments of the spine. In the top part there, we have the C spine, cervical spine, which is the neck. And then there's a bit of a debate about whether it's, what do you call it, cervical or cervical?
Cervical, it's like that's a yeah, I think about that. Some people call it.
Fair enough. I have my anatomy professor who said, if you don't know the difference between cervical and cervical, then you probably are lost with what we're talking about. So those are the cervical vertebrae, some people call them the cervical vertebrae, just to be really clear. And then in your mid back there, we have the thoracic vertebrae, also called your T-spine, pretty big term people use all the time. The bottom yellow section is your lumbar spine, which is your low back, all those big, nice, heavy vertebrae at the bottom of your spine. And the very bottom bit is your supranucleus, which is your tailbone inside your pelvis. So when we talk about different ways that your spine moves, we have flexion and extension of your spine when everything's moving forward and backwards. And then we have lateral flexion. So when you're moving directly off to the side in each direction. And then we also have rotation about the axis of your spine, just to make things really complicated. So between all three of those, you can move many, many, many different things in the spine. From the American College of Sports Medicine, PC, they have this little diagram of the ideal or normal, whatever that is, ranges of motion in your spine. It'll say 0 to 60. You can have 0 or you can have 60 degrees of range of motion in your spine. Just to make sure. So we have your cervical spine, your thoracic spine, and your lumbar spine. Everybody see this okay? Yeah. I want to make it big. And then we have degrees of flexion, extension, lateral flexion, and rotation that exist in each of those segments of your spine. So when we look at flexion, everything is equal more or less. You have more or less equal flexion throughout your whole spine, theoretically, depending on the person.
0 to equal. And then when we look at extension, backwards, you're so your lumbar is finding more and more stable in everything except for flexion relative to your sort of posture. Does that all make sense? Yeah. Just wanted to get an idea of what's supposed to move and what's not. So for two movement patterns, we're going to play with this after when we get to our practical. Two movement patterns that I find mostly impact people's spinal movement or excessive spinal movement is the shoulder blade and its connection to your body. Hip. So if you think about all those core muscles from that first anatomical diagram there, your core is ideally meant to hold your spine in the same place. So stretching your shoulders around, if your shoulder is a little bit immobile, or leave it on its hinge, you're going into an overhead position and try to move it. That movement is going to come from your spine, you don't have enough movement to feel movement. So then, like the low back, it's going to be extending more than it needs to, relative to what it should be doing in what it should be full back. And then your lumbo-pelvic, the fancy word for your femur, the pelvis. So the is the other one. So when your hip is moving, if your hip wants to move forward, but your brain isn't really coordinating with that, then you're going to end up with a big contact. Again, you're moving into your low back more than you need to. And same thing when you're extending. So if your brain doesn't know how to extend your hip without adding that movement from your low back, then that's also going to end up there. So your low back just kind of ends up being like the scapegoat for all movements that don't work well in the rest of the body. So on the bottom there, core awareness and stability becomes super important to make sure that everything's actually taking the loads it's supposed to be taking in movements in your body. And like I said, we'll work on all this stuff later. You guys can discover which parts of it you're good at. Can you speak up a little bit? I can try. I'm not a very loud person naturally. I'm gonna yell at you guys. Okay, so 80% of the population experiences a back injury in their lifetime, and that's like a lot. So the most common things that happen are sprains and strains. You know, that I pulled my back. The good one I heard recently was taking a cup out of the dishwasher. Strained my back doing that. Disc injuries. Everyone's heard about a bulge disc here and there, and fractures. I fell on my back, you know, those sorts of things. The mechanisms that people find to get into these situations are very different. So cup out of the dishwasher to, I had a big ski crash when I was taking a big air jump yesterday kind of thing. So everyone has a different story to how they achieved this situation. And then in terms of the research, back injuries are associated with, you had to pick factors that were going to kind of point out whether you were going to get a back injury. Decreased mobility, coordination, and strength in your core and your hips are a big factor. Increased age, kind of related to all those things, because as you age, those things tend to decrease. And then previous history of back injury. So someone who has gotten themselves into the situation the first time is more likely to end up in that situation again the second time. Surprisingly, in research, there is little to no correlation between your posture, between your posture and back pain, which I found really interesting because, you know, you're supposed to sit up straight for your back health. Now, that's not to say that the way you must sit isn't related. So if you have like really, really tight chest muscles, for example, and you're forced to sit this way all the time and move this way, that could definitely put you at higher risk for back injury. But technically, if you have all the mobility and movement available to you, apparently it doesn't matter how you sit. I found that really interesting. We can come across this little cycle over here. You can see it online, okay? Perfect. So we have an incident or an injury, and then we experience pain, pretty straightforward. And then you're going to change your patterns as a result. So who's ever gotten a paper cut and like 10 seconds later, you don't use that finger for the rest of the day because it hurt once, not that bad. So you change your patterns very, very quickly in response to pain. And then you're going to load your skeleton a little bit differently because things hurt doing it the one way. So you're going to do it a different way. which leads to overuse in the other tissues that are now having to be used more than the ones you're using before, which brings us back to pain again. So again, this really funny cycle. And this is one of the main reasons why they say motion is lotion. I'll bring that up again later. But if you have a back injury, don't just lay in bed. Kind of like one of the worst things, depending on the injury, that you can do, unless it is genuinely medically advised for you to lay down in bed. Does that all make sense? Yeah. They did some studies in a Danish study. They did a long-term study. They looked at people over, I think it was 25 years. These students, when they started, I think it was 1996 when they started the study. And so smoking was a big factor in relation to back injuries in these people over the next 25 years. Heavy job lifting, poor physical fitness, and then contact sports, only in the boys though, was a factor. I thought that was kind of fun. It was an old study. And then there's a Chinese study on medical students, and they found that proprioception, or your body's ability, your brain's ability to know where you are in space, decreased as soon as you had back pain. So as soon as you had pain, your brain was like, it just kind of wanted nothing to do with understanding what was happening in that area. And so that's kind of one of the factors that leads back into this cycle again. And kind of along with the posture thing, there was another study done on, it was all female medical students. It was also relatively recently. They looked at leg length discrepancy, and those that had a significant leg length discrepancy did not have necessarily any more risk of back pain compared to those who did, which I also thought super interesting. So I think that the lesson to learn here is that how you move and how you load your body during the day is probably a lot more important than necessarily your structure or how you're sitting. So coming back to that proprioception piece, where your body is in space and understanding your kind of general coordination is going to be really important. If you're not aware of what position your spine is in, you're going to have a hard time maintaining the position of your spine or making sure that it's in a safe spot. And then control is also really important for the same reasons. If you don't know where your spine is in space, you're going to have a hard time making sure it's not going to flop into a dangerous position while you're moving. So when we're training, you want to choose really simple exercises and get good at them. Everyone, not everyone. Some people really love to choose the cool exercise, or they add in factors that are more fun to training, like a Bosu ball or something like that, which makes it interesting, but it doesn't necessarily give your brain the ability to really solidify these patterns and the stability in a certain position before you move on. And we'll talk a bit about kind of how to add these factors in as we go. But the one key I'm going to say many times is make sure you are good at what you're doing before you move on. Important. So, for example, if we were to use a lower body loading scheme, like the hip stuff we talked about, who's ever seen the person squat and they come up and they do this big back arch on the way up? Yeah, big loading through the spine. And if you have 100 pounds on your back, that makes a big difference. So we look at control first. Something like a goblet squat is a really good example. You have a little weight at your chest, and all you do is a little squat all the way down and all the way up. Super simple, very controllable, easy to pay attention to, but tricky if you don't know what's going on in your body. Lots of people will squat only with the knees, or they do that scoop I was talking about. So it's a good example of a really simple exercise to start off with. And then what we can add is variability. So in this example, we go to a split squat or a unilateral motion where you're on one side, for example. And then after that, you would go back to 2 feet, but you add load to it. So you're adding weight. And then you're kind of challenging everything in a progressive way. But again, since we're mastering each stage, it's all very safe. And then you would add load and variability. You can see where I'm going. And then the last factor would be speed. So once you've really felt comfortable doing all these things on one leg and 2 legs, then you can start to add speed in with something like a jump. So it's the same movement pattern we started with, but now you're making it fast. And then we do it one-sided. So we have speed and variability in there. Does that all make sense? And then you can get someone like throwing a ball at you that you have to catch, etc. But the theory is that once you've gotten to this stage, this skill and this pattern should be ingrained enough in your positioning that you can take it into the real world and be pretty resilient when you're in this kind of position. We're keeping it simple. And like I said, getting redundant now, but do not progress to something unless you have full mastery and control over the exercise or the movement that you've been practicing. So a couple other ways that you could think of progressions. The simpler version would be on the left side over here, and then the more complex version would be on the right side. We'll do a few examples. The first one is a core exercise. There's some hips in there too, but if we talk about being straight and then going into rotation, this is the Palloff press. Anyone heard of this exercise before? Yeah, I love this one. It's great. Because we start off in a straight position. The band is perpendicular to you when you're doing it. So as you push the band out, the band is pulling you into rotation, but your core muscles have to maintain your position. It's called an anti-rotation exercise. So when we start this one, you have to maintain a straight position, and your core is responsible for stabilizing your spine without moving. And then the progression to rotation would be to add, once you're extended, an active rotation using your core muscles, but still stabilizing your straight spine into the motion. Does that make sense? And then when we talk about neutral versus flexed spine, now I'll talk about this in a second. Bad idea. Little disclaimer, I would never ever recommend lifting in this position. There are people who think that there's philosophies on that. I'll talk about that in a second. But so a neutral spine would be the example on the left there. This is a deadlift or a hip hinge. It's a relatively straight leg deadlift. So you can see that this person is maintaining a load via control of their neutral spine as they go down. So it teaches, we're going to talk about this later in terms of what to add into your training program. I really like this one if someone is capable of doing it well, because you have to control the load for your whole spine as you're moving all the way down. And who doesn't pick up groceries like that? Like that motion comes into your life so often. But that would be an example of loading a neutral spine and doing it in a relatively controlled way. Maybe not with the barbell to start off with, you get the idea. And then this would be an example of loading a flexed spine. Again, would not recommend weight training like this. However, if we just remove the barbell, the flex spine is going to exist in life. Like you're gonna, pop down on the floor to pick something up. It's just gonna happen. So if you are feeling comfortable with your neutral spine, that's when you could start to very, very slowly and with extremely little load work on controlling a nice flex spine motion. Does that make sense? Do not lift with a flex spine. All right, and then we talk about simple and complex. So again, same example as before, you can use the goblet squat all the way to doing a single leg lunge or a split squat with a barbell on your back. So always keep things very straightforward. Feel comfortable doing your exercise. You shouldn't feel like you don't know what's going on. You should feel very confident and like strong and heroic when you do your exercise, and then you move on to the next one. And then the other thing we talked about is single joint to multi-joint. We're going to talk about why squats are a useful movement pattern to keep the back healthy and happy, but this example is more about knee extension. So the only joint that's moving in that case over there is knee, as you're just working on extending it up, single joint to multi-joint. So it's kind of one of those examples where you're going simple to complex, same kind of idea. Everything, you're making sure you have good control over the one joint before you go adding in 6 joints. Any questions about that stuff? No? And then we talk about the principle of overload. So how do we train? Like how often do we go into the gym? What do we do? And how hard do we do it? So the idea with most training is that we want to do the minimum training for the optimum benefits. Makes sense. Kind of how we do most things. We have this fancy, simple super compensation curve over here. So when we look at when you train, before training, you're kind of on this baseline of fitness level. And then when you train, this is your training stimulus here, you're going to fatigue yourself. And so you have this fatigue existing on your fitness level. Your fitness decreases more or less, if we're talking in the global sense. And then your body recovers, and because it underwent a stress, it overcompensates. And that's when your fitness is increasing because you've adapted to your training load. If you do not train again, you're just going to come back to baseline and you'll kind of repeat this cycle. You'll still learn some stuff. You'll have a neurological benefit. Something is always better than nothing. But if you train at the optimum time, then you can kind of continue to increase your super compensation strategically. So the most important thing is to pay attention to how you feel, because this curve is going to look different and it's going to have different durations depending on the person and what exercises you're doing. So pay attention to how you feel, your body is responding to the training. And then this is a pretty general rule. Like I said, it's going to be dependent on the person. But if we're doing muscular strength training, so that's in the realm of 4 to 10 reps, give or take, then we want a minimum of 48 hours of recovery before you're going to do that kind of workout again. So like a Monday, Wednesday, Friday kind of thing, if you want to work out that often. If we're talking about muscular endurance, so that's more in the 10 to 20 rep range, then we want something more in the 24 to 48 hours. Doesn't have to be as long because there's not as much stress on those muscles when we're training over lower weight and higher reps. If you're sore, wait more. It's a very easy rule of thumb. Soreness is reasonable when you're doing your exercises, but it's certainly not necessary, especially when you're coming back from an injury. You don't need to go to the point where you're getting like wasted every time because you can't, sit down anymore the next day. That's too much, especially in the muscles that you're trying to rehab. So when we talk about different training movement patterns, I kind of ordered this in order of importance, in my opinion. I'm sure people would. There's lots of opinions on back injuries. So a squat is one of those ones that I think is really valuable. Where you can see that this person has the weight loaded on their shoulders, and then your core has to take care of your spine position under that load. It's very transferable to lots of things you're doing in daily life, going upstairs, anything, sitting down. So we take care of hip mechanics and your torso control with movement in the squat pattern. A hip hinge deadlift is another good one. Like I said, we hip hinge all the time. Nordic skiing, anybody cross country ski? It's largely hip hinges all day. Here's flat skiing. But like I was talking about before, the load is on the other side of your back compared to your feet that are pushing your load on the floor. So your cores and your back are responsible for managing that load in that middle zone. And then we talk about isolation of the hips. Just like we mentioned before, we're going to practice this in a little bit. But this is a really good exercise for practicing how your hips and femurs are going to move separately from each other, and they're not going to lock themselves together when you're trying to move. Like more sense when you try it. And integrity through the spine with load. Proprioception. Does anybody remember the definition of that one? No. Yeah, your brain's ability to remember where your body is in space. So like I said, if a person doesn't know where your hips are, you're probably going to have a hard time controlling them. I was trying to find a picture of someone with a foam roller on their low back because that's what I think people do all the time for proprioception, but apparently no one else does this for people. So if you imagine a little foam roller on top of this person's back, so this is a shoulder tap exercise in this case. And the point here is that we're trying to teach the brain how to stabilize things while we move around. So if you had a foam roller or a water bottle or a glass of wine on your low back, and you're trying to not let it move while you lift one hand at a time, you have to avoid all the tipping that wants to happen in your hips when you do it. So little moments of feedback like that you can give yourself are really good. Most people are unaware of how much their hips are wiggling when they do this kind of stuff. So I like just giving yourself a simple tool that makes it really easy to know what's happening back there if you can't see. And then core. So your core is obviously the piece that controls your flexion and extension and your rotation and all that stuff. My two favorite exercises that I use with just about everyone is a dead bug. Anyone done a dead bug in physio before? Yeah, very common one. We're going to talk about this one too. So in this example, the person's laying on their back, and your core's job is to hold that flexion through your core, through your spine, to make sure that as you extend your limbs, your spine isn't at the mercy of the weight of your limbs when you move. So it's a really simple one. I really like it because you have the feedback of the floor, and that gives you the proprioception, tying it all together, to make sure that everything's aware or not aware of what is moving. And then it's also really hard if you do it really well. And the last one is shoulder mechanics. So stuff where you're doing shoulder press, you're hanging so that you can make sure that those shoulders are strong and moving mobily and independently of where they're hopefully not drawing your spine. Does that all make sense? Any questions about these exercises? Anyone online? Not yet. Not yet. Okay, this is an important piece too. Now, I'm gonna say this is not an exhaustive list, and if you are worried, please just go see a doctor. So things that are not great are recurring pain down your limbs, numbness, tingling, muscle weakness, incontinence. This is mostly in the case of a spinal injury kind of thing, you know, or a fracture. If you have a sudden onset of pain in a very specific place on your spine, especially following a fall or an impact. And then this one's a little more subjective, in my opinion, worsening pain. If you kind of pull your back and it's been 2 days and it's getting worse, that's kind of a bit of a red flag too. Or if it's been a week and it's definitely not getting any better, that's also a bit of a red flag. So that would be time, less urgent, but time to go see somebody about what's going on. And maybe we need some interventions to help fix it. Do you have anything to add to this one, Jacob?
It's a bit subjective, wasn't it?
Subjective list. It's from the International Spinal Red Flags. Official document. Okay. There's references behind all this. Anyway, so to give you guys a quick summary, see a medical professional if you're worried about something. Keep moving because motion is motion. Start with the simple things, do them very well. This won't do you wrong. So if nothing else, it doesn't matter if you're progressing. If you do one thing really well, that's always good. Gradually increase complexity and load, as we talked about. Overall strength in your whole body is good for your back health because if something else is not doing its job, your back is going to end up being a scapegoat for it. Be aware of your body's responses to training and ask someone if you don't know what's going on. There's a whole host of lovely professionals in this building, especially in the Vascular Med Center, that are very handy for answering questions. Speaking of questions.
When you were talking about the progression of
Yep.
the movement, would it be the same if you already have some kind of compromised joint in your body?
No.
I'm talking about aging. Question.
Okay. Do you have a specific example?
That is.
Okay. The
So
squat
somebody
specifically?
With that strength in
Yeah.
the knee or movement in the knee.
Yeah.
Would you go in the same steps?
No. It would depend on what's going on. In some people, in my practice, some people can tolerate increasing that stuff. The timeline and how you do it just looks differently. So we might start with a squat from a chair, and then work to the freestanding one. And always having a mirror in front so you can see what's going on and make sure that your joints are loaded, ideally. Often, if we make sure that the mechanics are really, really good, we can deload some of the angry stuff on the knees. And usually we can get away with still doing a squat, but in a happy way, as long as it stays happy. And then kind of progress from there. So that progression that I showed you, I forgot to mention, in a lot of people, it takes like a year to get to that from beginning to end, because it takes a while, depending on the person, for the brain to really keep up with all of these changes. And we can kind of keep things interesting with different modalities or loading schemes in the meantime. That's kind of a general idea. Does that kind of answer your question? If someone has an injury that they can't do that sort of movement, then we would just get creative and find a different way to do it. Like maybe we do the knee extensions and then you do a hip extension instead, but you don't do them both together. Yeah. Any other questions? Are you guys ready to practice now? Okay, everybody stand up. These are hopefully the things we're going to get through. Okay, so we're going to start off with hands on hips. And what we're looking for here is to make sure that your spine stays in the same position while you're moving everything. So the easiest way I find to do that, make your fingers really, really wide. And your index finger is going to go on the bottom of your ribs. And your pinky finger is going to go on the top of your hips. And then your thumbs are in your low back. So you know if your low back is helping and you know if things are starting to tilt around on you. Good so far? Okay, so put your feet together. And then we're going to bring one knee up towards your chest. If you're looking to see if your pelvis is going anywhere, while you do that. And then we can put it all the way back down. Some people, if your hips, well, we can talk a lot about what's going on here, but the main idea, we're gonna alternate marching each side. Make sure your shoulders aren't too helpful with moving your feet around. It's tricky if your brain's not paying attention to make sure that your pelvis is helping you. The second one we're gonna do is that hip extension I was talking about earlier. So with that kind of firm grip on your hips, your pelvis is not allowed to tip forward and backwards. The visual I like is a bucket of M&Ms. So if your pelvis is a bucket of M&Ms, you're not allowed to pour them out the front. Don't lose your M&Ms. So everything's nice and tall, and you're gonna take your femur and extend it to the back using your glute muscle, but also without letting your pelvis tip towards the front. This one's hard. So do a couple of them on each side. One of them is usually easier than the other, but you want to make sure you don't have any help from those low back muscles. And then make sure you breathe also. Aha. Breath holding is a common symptom. Does anyone have any questions so far? So these are kind of themes that translate to a lot of movements. If you're running, if you're doing track drills, if you're a runner and you tend to be a tipping person, then every single one of your running strides is probably to some extent going into your low back. Same with skiing, classic skiing, coming all the way up on your knees, if you're going downhill, hiking, ski touring, skateboarding, any of these things are all going to be contributing to the lack of stability for your pelvis. And then we're going to do shoulders. So, the mirrors are actually convenient if you guys happen to have one. You would turn to the side, and then I'm going to show you from the side here. So your hands are going to go in front of you, feet together, ribs are going to start stacked over top of your pelvis, and then you're going to raise your arms up overhead, and you're looking to make sure that you don't add any back arching to do it. How does it feel? Yeah, most people find their range of motion is not quite the same as what they thought it was. Yeah, everybody's different. Not exactly. It's common, and there's no reason that you would have necessarily known this before, which is why I love bringing this up for people, because if your shoulders are kind of cheating into your back a little bit, then they're still getting up where they're supposed to be, but not with the right needs. So the idea being that you can keep that core connection, and we'll talk about the bed bug in a moment, the same idea, where you're keeping that core connection so that your shoulders can actually do their job and they don't steal range of motion from your low back. Any questions?
How do you develop range of motion?
It's a good question, and it has 1,000 answers, depending on where you're at. There's many reasons why your shoulders might be stuck. It could be, you might have an actual bony limitation in your shoulders. Could have soft tissue stuff. Usually a little bit of rolling in collapse helps people to open up a bit, but it depends on why you're tight. Usually I have good success rolling for people, and then it's easy enough for them to get overhead, especially if you're a climber or an ice climber. Overhead is an important position for you to be in. Realistically, if you don't need to actually be overhead all the time, as long as you're not helping with your low back, it doesn't matter that much, but it depends on the person and what you do. Any other questions about shoulders? No. And then we're going to do a dead bug. So we're going to be down on the floor for this one. I'm going to get you guys to keep standing so I can demonstrate this one first, and then we can sit. Okay. So to do this one, first, you guys are going to bring your knees up. And when you do this, you're going to send your leg out away from you and see if you get that tip of your pelvis exactly like when we were standing. And then you're going to do your arms and see if you get that reach of your ribs exactly like when you were standing. So what we're going to do is put your fingers on the inside of your hip bones when we try and look at your muscular connection across here. There's many muscles in your core. But the main one that we're targeting is your transverse abdominis, which goes across your core. I think of it as the muscle that kind of packages your torso together a little bit. So your fingers are just inside your hip bones, and you're going to use those muscles to press your low back down towards the floor. You with me so far? Okay. So once you find that, these muscles should come up underneath your fingers, and you're going to hold those as you pick up each of your feet. Now, most people will pick up their first foot, and they're still nice and stable because their other leg's on the ground, and then the second one does one of these.
So if that happens, try again, because usually you figure it out the second time. And just like I've been going on and on about, go slower. Because your brain needs a moment to figure out what sort of tension you need to create in order to pick up that other foot if it's not used to doing that. Does that make sense? Okay, who's ready to try it out? Give me a wave if you have questions. Or anybody online, if you guys are trying this out. Don't forget to read. But it's okay to hold your breath while you're figuring it out.
Give me tricks to turn the TA on. Is it, I don't know if it's all-
Usual question.
I know, yeah, I've heard of the copying technique or the.
One that Jake Watson uses is if you're gonna exhale, do like first flips, you do like kind of exhalation.
Yeah.
Then that will turn on a little bit.
Okay.
It's kind of a simple solution. You still need to like happen from
Right.
so practicing more.
Like, just like moving your back, you're like that, you think my arm is that, probably. Yeah.
So when you're very fine harness, if you kind of leave your head left on the floor, and then you think about pressing your core out into your hand, there you go.
It's pretty good.
Yeah,
Is
and
it
then
okay to like engage the rest of arms at
Yeah.
the same time as you?
it will also feel real. If you just don't have to dominant. So you'll, a big good point, you'll know that your TAs are working well if your core is kind of flat across the top. So if you find that you look down and there's a big dome in the center of your core, your rectus abdominis in the center, that six-pack muscle is probably taken over relative to your transverse abdominis, your packaging muscle. If that makes any sense. It's hard once you pick your head up, sometimes it kind of does it anyway. But if you have your hand across the top of your stomach, you can kind of notice when it starts to pop upwards as opposed to remaining packaged outwards. Yeah, it's hard.
Chills.
Yeah.
When I, when I have this. Get rid of air, that's.
Common. Shake my head and turn my head.
If I sort of top over top of the socket of your jump on the pelvis. So one of the flexor muscles there, submuscular goes from the femur into the onto the front of our lumbar spine. And so as your muscle lengthens, as you lower the floor, and then needs to track a little bit more laterally. So flips over top, and some people flips over top of the bone of the socket.
It's like breathing.
Okay, so if you're doing on the back side, which would be a less common, but also somewhat common area that could be SI joint. That would be the second most common location. It could be perhaps you have a laxity in there, sort of. So with it, you're not saying well, when you put volume, so
You can also, so not every single thing, this is more than this fine. This is what you're fine. Which is why it's hard to share. But, if you're finding that it doesn't work, you can put in a little power or something, and then you can go back. You can do a bit of a bridge in that space and sort of, I don't know if you do that.
Not only stretch your control.
Also, people who
Some folks in the
on your final achievement.
Just shape
So,
your.
I always.
Not over again because yes.
Yeah. If you ever use stress, but the little exercise will be one over that, like everything kind of down to your level. So really I think you're going to do that. So I'll be doing this way. This is to go back to this one. This one. Usually comes up 3 days later with people once they figure out how to first. But theoretically, you should be reduced in the time.
Okay, so there's no like. We should be
I start practicing, so you start holding the core tension and practice breathing, so you kind of create this like, cylinder in your torso, you're breathing in, all smoothly, independent of what the legs do.
Right.
Yeah, theoretically, hard to do.
Yeah.
Any online questions? Okay, how are we feeling so far? Good. Did everybody bring a water bottle or a shoe or anything like that? Do we have a shoe here? My water bottle metal, I don't want to let it. Oh, we have like yoga blocks and stuff. Perfect. Okay. We're gonna do a bird. We've done bird dog for their back video before. Yeah, that's a very common one. So we're gonna try that out, but we're gonna add that prop business I was talking about so that we can increase the proprioception that we've got going on.
So there's no water.
There's no problem. I know.
I think mine was.
My class, my class. Say whiskey? So start with water and then you're gonna share it. Okay. So we're gonna be in a quadruped position, all fours. So like your wrists are underneath your shoulders and your knees are underneath your hips. And then you guys mind tapping in one. Part of the long one, we're going extra level here. As far as we all get okay, who has a full roller at home? Some way, shape, or form. Yeah, empty water bottle works well. The full one's hard because the water's sloshing around, so it's like level 2. So you're gonna have your toes tucked under, and then the first thing we're gonna do is gonna be surprisingly hard. So we're gonna have a prop on your back. Oh, or we'll put a cross. Anything wiggly. Anything wiggly. Yeah, water bottle works well. Or shoe.
Well, it's definitely not right.
Who had trouble getting it on? Okay, I had a hockey player the other day. One of them forgot he was going around. Okay. Are we ready, Isha?
Just hold still for a second. We're gonna stay right here. So make sure you have like some security of your object. And then when you're in your quadruped position, your limbs are all stacked. So again, knees are under hips, we'll double check. And wrists are under shoulders. And then what you're gonna do to start off with is reach forward with one arm at a time. And your object is not allowed to do any wiggling. Oh, ooh. So this is the easy one. And you can kind of feel like your shin hand to hand. A little bit of activation that needs to happen. Think about it a little bit more. A little bit of activation that needs to happen in your core. Okay, and then level 2 is reaching a foot out. So I would recommend widening your hands a little bit. So you have a bit more of a base. And then what you're gonna do without letting anything wiggle is stretch one foot to the back. Doesn't have to be super high. And then you're gonna bring it all over back. And good side. Oh, sorry. That's hard. Wide hands, narrow knees. We're gonna lift that knee up and press the foot all the way back. Oh yeah. Oh, and you feel how much your pelvis moves when you're moving your knee around. And how much private core work is happening when you try and do it. Okay, we're ready for level 3.
Oh my God. Oh boy. I'm not comfortable yet with level 2. Are we supposed to be comfortable?
That's true. You do not have to participate if you're not comfortable. Okay. So we're gonna bring knees a little bit wider and hands a little bit narrower for this one. This is gonna start. Tuck your toes under. And when you guys are ready, you're gonna hover your knees off the floor ever so slightly. Make sure you have lots of pressure in your belly button up towards your spine. And once your knees are hovering, you're gonna pick up one hand at a time.
Oh, yeah.
Try using your core. Press through your toes and your hands.
Okay.
Yep. Make sure you breathe. Relax. Nope. I would only recommend doing a couple at a time when you get to the grade.
Oh, that's not it.
You can. Yep, a little bit.
And kind of hold that cylinder as well.
This is why I feel like long.
It's incredible how mindful it needs to be. What's helping for meditation? You're trying to see like maintain that core. Just stabilize. And breathe.
And be ready for the same time.
Very comfortable.
How do you know if you're turning to bra?
You should feel it working. Yeah. You'll know. If you have a hard time breathing, probably working. Do you have any other questions on this one?
You have too much arch, would it?
This way?
Yeah.
If you have to have quite a bit of arch to deactivate your core. Yeah, there's different positions for different people. So different people are, some people are going to land here, a little bit naturally. Other people are going to be the other side. Other people are going to go the other way. So it just depends on the person.
Sure, you don't put your toes, you try to suck in, like you're.
Not sucking it in, but you're doing that packaging in your top of this. Yeah. Does that make sense? Yeah. Okay. Let me do it.
This way is going to be inside of the
The six-pack ones are usually easier to get on with them. I think there's and then your TA to go across are 101. They're usually bigger. You're aware of it. It's step one. But breathing is usually one of those things. So if you breathing on the floor, okay. However,
sinking to the other side. Is that, you know what I mean?
Not good.
Okay, but you know what I mean? Like,
Nice skill.
when I lift up.
Yeah.
In order not to make it move, I'm almost kind of sinking to the side.
Yeah. So we're going to use your core instead.
Okay, so I'm using my glutes, right? Is that what?
Only to lift your leg.
Okay.
Yeah. So start off with your fingers holding down a little bit. There you go. So you feel all these guys hold your shoulders. Yeah. Okay. And then you're going to press up your leg and down here. Without moving your spine, but using that tension in your voice. There. Okay. Now you're going to hold both of those things and slowly start lifting a leg. And just use your glute right about there. As far as you want to go.
Okay. So, yeah. Okay, so I would get my student down, so I'm compensated and this pushing up to the side.
That's what we do.
Yes.
Yes. All right. How's everyone doing? We're alive so far. It's so good. Okay. And then the third one, the fourth one we're gonna go through is RDL. And I remember what that stands for. Romanian. I don't know why I'm Romanian. I'm like, how it is. Okay, I'm gonna use this, my example. So I always teach people this with a proper wall. I always use a wall for people to start off so that you're really aware of where your hips are moving to. Again, the proprioception piece coming back in. So if you guys want to try it like this, you're going to stand 1 foot length away from your wall to start off with, and that's where your feet go. You go any farther, you may or may not actually have enough mobility to reach the wall, and you're going to be really frustrated because you can't do it right. If you get too close, then you also won't be able to move too far because you have enough mobility. So knees are going to be nice and soft, and we're going to do our fingers between ribs and hips again. And same M&M roll that we had before, but this time you get to pull it out the front. So knees are soft, and this piece of your torso stays together. It's not going to change the middle track. So keep everything together, and your femurs and pelvis are what moves separately. You're going to send your tailbone behind your heels back until you touch, don't recommend it, until you touch your target, a wall or a post or something like that. And now you've stretched out and lengthen everything to the back of your legs, called your posterior chain. Your glutes should be loaded, so your hips are behind you, and your hamstrings are also loaded. And those are the muscles that you use to come back up to the top. Does that make sense? So common things that happen with this hip hinge are that people lean forward, and then your center of gravity becomes more around here. Or
they go down far enough, but then they add a bunch more, and so you flex through your spine when you get down even farther than that, and you have to unflex, you have to unflex or extend your spine on the way back up. So now you have to load that in the movement. Does that make sense? So you're looking to keep all of this stuff perfectly still as you hinge all the way down and all the way back up. Third thing people do is a really nice on the way down, and then they go "Ooh," on the way back up. So the easiest way to avoid that is to really initiate your way up using your hips. You guys with me so far? Okay, well, I'll walk you through it again. So everybody grab a wall. You can use your foam roller if you want. I just think it's a little bit like, there are enough walls in here? Or a chair. Chairs will work, actually. Anything with like structure to it. Perfect. I'll bend you. Okay, you're only on camera. All right, so once you have your wall, you're gonna move 1 foot length away from your wall. And then your feet are gonna be about shoulder width apart. And then we get hands, ribs and pelvis, and then same feedback on your low back so that you know if you're no shrugging allowed. So that you know if you're helping with your low back. Knees are nice and soft. And then we're gonna, in the brain, solidify the torso together. So you've got a little tiny bit, not too much of that core tension, it's just there. And then you're gonna tip to send your hips to the back and reach for the target that you have behind you. So your tailbone glides behind your heels. Good. And then you should feel a nice big stretch on your hamstrings when you get back there. And those are the muscles you start with on your way back up to the top. Yes. I think that's why we have the target. So you really move behind you as opposed to falling forward. Yeah. Try a handful if you give me a weight. No, good question. You don't want to like tuck under the floor. If as you go down, you kind of maintain the angle here, and then you shorten that as the force goes tall. Keep your weight in your feet. Yeah. So when you do weights, you're only doing it depends on your mobility. So some people are, I've met people who are mobile here in a pinch, and they're like super stuff. And but like yeah, yeah, exactly. It is also a really good tool for hamstring mobility because of the different broad discussion. Yeah. And possibly there's like a little engine in the back, or people are not sure. Yeah, as long as there was like a back, but.
And then it's going usually not too.
You guys are being too very tired. You don't like the smell. How are you doing? All right. This one kind of makes sense. This is a motion that is used in the gym all the time, but often poorly used, if I'm honest. Hopefully not by my friends, because we've been working on it. Does anyone have any questions about a hip hinge or a Romanian deadlift? No? Okay, so to kind of bring things back, that comes back to the dissociation piece where if you're hinging funny, then your back is going to get loaded on the way down or on the way up disproportionately. But if we do it really well, the only thing your core has to do is hold your spine stable. So in my opinion, your core isn't really supposed to be a big mover, unless you're a rotational athlete like a pitcher, like taekwondo or something like that. Most of us aren't in that field. So your core's job is to stabilize you while your other joints do the big moving. So make sure that you keep that in mind when you're practicing whenever you guys are going to go home. Like, I forgot how to move my body. All right, how's everyone feeling? We want to do one more thing? Yes. Okay, you guys need a chair for this one.
Do you want to chat demo?
Yes. Okay. Actually, I think I'm okay. I think that's okay.
Oh, no, it's okay.
Is everyone trying this at home? Is everyone trying this at home? Okay. Good so far? So ideally be on the floor if you can. I'm with you. My feet never hit the floor. So you're gonna think about having your butt bones equally planted into the chair, and you're gonna stay there the whole time. So the first thing we're gonna do, so you remember the first 5 movement I talked about? Flexion and extension, and then we have lateral flexion and rotation. Yeah, you have to do these arms please. So we're gonna start off with both of your butt bones plugged into the chair, cross your arms over your chest. And now the tricky thing is your shoulders are going to try really hard to help your spine do all this moving. So make sure they stay relaxed and breathing is still good. So we're going to start with flexion. You guys are going to be seated in your chair and start with, we're going to kind of go top to bottom in terms of the vertebrae of your spine. So we're going to flex theoretically each one at a time as you curve forward. You start with your chin, second down towards the chest. And you're working all the way down to your maximum flexion. It may not be very far. Yeah. Without tipping your pelvis. So your bum stays exactly where it is, and you're only flexing theoretically through spine. Do you feel all the tension down your back? Keep going. So when you get to the point where your neck is tight, then you're gonna add your C spine and your C spine to it. It feels gross.
Should you go like to your lumbar, like should you be like?
Yeah, all the way down. I can't do it firsthand, but I don't know how our questions. But theoretically, you're gonna be like in your chair. Does kind of make sense? Okay, so come all the way down, and you guys can hang out there for a moment. So everybody's gonna be fully flexed. And then when you come back up, I'm going to describe this so don't look up. There's 2 ways to do it. Lots of people kind of peel from their low back first. So what we're going to visualize is stacking each vertebra backwards onto the previous one. You're going to start in your lumbar spine, and you're going to stack your spine from the bottom to top. Make sure your shoulders relax. Anyone breathe in the last 30 seconds?
It's so fun.
This is one of those really simple, very gentle exercises in flexion you can use to work gently on your range of motion because it's unloaded. So it's relatively safe unless you have some sort of injury or pathology that you shouldn't be flexing. If it hurts, don't do it. It's kind of like, my dad used to say that to me. My thumb hurts when I do this. He'd say, well, don't do that then. It's a simple rule. Anyway, so it's a nice, easy way to kind of work on your ranges of motion and have your brain feel more comfortable with where your spine is in any situation. Makes sense? You can do the same thing in extension. I don't love extension seated. I think it feels really awkward and you fall back. So that might be a better cat cow. Everyone knows. So the second one we're going to do is lateral flexion. So you guys are going to be seated. I'm going to try and go through the one. You're going to be seated again. This equal bum bones is really important in this one because you're going to lean over onto one cheek when you try and do this. So same thing. You're going to take starting from your C spine, your upper neck, and you're going to feel everything directly over to the side. But you have to make sure you're not twisting when you do it because one shoulder will come forward compared to the other one. Shoulders are relaxed, both bum bones weighted. And we're flexing as far as we can, theoretically, including your C spine and your T spine, and then your lumbar spine. And when you come back, you're going to stack the exact same way we did before. So each piece together kind of back on top of the previous one. You can go in each direction while we're here. The buzzword name for these is CARS, controlled articular rotation. It's an easy term to describe them. People get a little overexcited about cars, in my opinion, but so it's kind of making sense. Usually it feels easier the second time. And if you find that you have a really, really sticky point, this is more mobility based than necessarily like back health based. But if you have a really sticky point, like for me, it's right here, and you take a few good breaths, it'll usually open up for you while you're there. But you have to be patient. Okay, and then when you guys get stacked again on your next one, we're gonna go rotational around the spine. So you're gonna visualize like the spine has a huge post all the way through it, and you're going to rotate the exact same way directly over top of the post in your spine. So make sure you're not arching your back when you do it. That's one of the easy compensations that happens here. So keep your ribs down. And you're going to turn as far as you can, one piece at a time. And then you're going to stack back forward one piece at a time, just like we've been doing. Most people start with their neck. Living the block life. Most people notice they have one section of their spine that prefers to move in a huge chunk. So this is a good time to become aware of those things.
What's the rotation, like how much can you do?
It depends. I would be more worried about more rotation on one side versus the other. Otherwise, you don't have to be too worried about a lack of rotation until you find there's a limitation for you.
And you want fairly even.
Relatively, yeah. Just be kind of like your lumbar won't rotate very much, but your rotation will increase the more you get to the top. You should be able to look over your shoulder. With just your spine, and then you're kind of adding the second to your spine. And all the way up. No. If that works for you, go for it. Okay. How does it feel? All the lines, not the same, yeah. Most people, I've never done this in people. Very normal for you to be more on one side than the other. The issue is when you're like way more on one side than the other. That's good enough red flag. Maybe you should go too far. If you can't stretch it out yourself, or if you practice rotating towards your grumpy side a bunch of times, you never get any better, then it might be handy to go see someone, especially if you're feeling effects from that. The general rule of thumb is if it ain't broke, if it ain't broke, don't fix it. So if something's not bothering you, you shouldn't have to do anything about it. One could argue. If you have something that's really nasty that's almost definitely going to bother you in the future, you should probably get it checked out. And again, if you don't know, just go back. You have to mean. All right, that's everything I have. Does anyone have any other specific questions? I'm sure you might come on now. After all the movements you just did. Okay. Everybody's just focused on where their spot is at home. All right, so that's everything.
Respond like strains. Otherwise. These emotions,
No, it's a little bit.
really lock that.
Yeah, whatever you can do is kind of like what answer. Most, if it's not something that's structural, if you don't have a tear or a fracture, you should be able to get away with like going for a gentle walk kind of thing. Or even just walking back with the front of your house if you're not brave enough to leave the house, depending on how icy it is outside. Walking is supposed to be one of the really good ones. If you can get away with some like gentle cat house, that kind of thing, any of this kind of stuff should be good. But you just go to a lesser degree, so you stay super comfortable with it and just work on getting a little blood flow and like movement at all happening in there. Most people feel better after moving around a little bit, and then it's when you sit that everything kind of gets that tense state going on. So moving is usually better. Yeah.
And I love how scale it.
I don't think I can answer that question. It's not really in my scope of practice. That would be more of a Jay question. It's super dependent on what's going on. If you're upwards of a 5, you might be in the tear zone. You'll know, you should know what it feels like. If it feels muscular, then you can kind of wiggle it out a little better. But the pain is supposed to be getting better as you do it. If the pain is getting worse when you try and move it, you can try something else. Yeah.
And if you've been injured, how long should you be waiting before? Like,
What kind of injury?
Oh,
Like a pulled my back.
yeah, maybe, exactly.
From my experience, it's better to do something right away. The sooner that you can kind of cut off that spasm, the better off you are. So if you can go get in and see like a massage therapist, or if you get a ball rolling happening immediately, that usually helps make it less nasty because you kind of stop that spasm cycle. Moving is usually better sooner rather than later. If you don't stop moving, then you won't stop moving. So if you keep walking or whatever, then you won't get that state where you sit down and freeze up so much. But if you're worried about something that's actually torn or injured, then it's kind of a different question, depending on what your injury is. Yeah.